Hi friends, June is Men's Mental Health Awareness Month, and hence this video is for all the men out there. I'm going to be talking about the different types of mental health challenges that is faced by men in India. I'm also going to be talking about the reasons and what could be the possible solutions. Let me share some numbers with you. We at Wellness Space, which is our wellness center in Ahmedabad, have been working in our clinical practice, working in the area of mental health for the last 10 plus years. But it is only in the last 3 years that we have gathered data about the clients who come to us. And what is very, very surprising is that in the last 3 years, our data shows that only 30% of our clients are men, which means that only 3 out of 10 people are men who come to us for mental health help. And this is not a good sign, because this shows that men who may have mental health issues are not easily open to taking help about this. The reasons for men having struggle with mental health issues largely comes from the societal pressure and the societal expectations, which is very different from women. Women are usually perceived to be emotional and vulnerable, and hence women are encouraged to take help for mental health issues versus men. Men are, forced by the society to man up, to be masculine, to be in control and in charge of their emotions. Men are not encouraged to take help from others. They are supposed to be very independent. They are not encouraged to speak about their vulnerabilities or weaknesses. They are not even allowed to share their emotions. And from a very young age, they are not even encouraged to cry. Men are supposed to be the breadwinners of the family, and they are supposed to be holding it all together. And this is one of the main reasons why men have mental health challenges versus women. And this is also the reason why men are not comfortable to seek help or not even willing to accept their mental health issues. Men who are most vulnerable to mental health challenges are the men who themselves have a history of severe childhood trauma. They have come from violent, dysfunctional families as children. Men whose wife has mental health issues are also vulnerable to mental health challenges, or men who have children who have special needs, like children who are autistic or on the spectrum. Also men who have addictions like drug, alcohol, porn, etc. do have mental health challenges, or men who are facing health conditions or chronic health issues like diabetes, blood pressure, cancer, etc. Also men who have violent and abusive behaviors themselves towards their family members, and men who have isolation or who feel lonely are the ones who really need mental health help. Men who have marital issues. So there are men who have issues with their wife and also with their own family members are the ones who oftentimes struggle with mental health challenges. We have data of 311 men who have come to us in the last 3 years. Let me share some numbers about their mental health challenges. 83% of these men have some sort of a fear or phobia. 55% of these men have some sort of a relationship issue or a block with their parents. 70% of these men come from violent family environment, and they have severe depression and anxiety. 1 in 3 men who have come to us have had severe anxiety, and 80% of them have a history of coming from violent families. 55% of the men who have come to us have had history of physical abuse in childhood, but 90% of them do not accept it and tend to normalize this abuse. So they do not see the physical abuse as a problem. 40% of men also come with issues of loneliness and isolation. We also have men who have come to us with certain issues that they do not openly discuss, even with their wife or their family members. These are men who have a history of sexual abuse in childhood, or who have confusion about their sexual orientation. So these could be men who are either gay, homosexuals, or bisexuals, but they have been forced to get married by their family members. There are also men who suffer abuse at the hands of their wife and children. These are the men who get regularly, verbally or physically beaten up and assaulted by wife who has an anger issue, or children who have anger issues themselves. So these are the different types of problems that men come to us regularly for help with. And especially these men who have who are generally more softer, more emotional, who are vulnerable to being abused by their family members and their wife, are also very ashamed to talk about it because the society looks at them, society makes fun of them and does not encourage them to talk about these problems because they are labeled as weak. Men who have a history of sexual abuse in childhood also tend to develop confusion about their sexual orientation as adults. And in our society, yet they are not able to talk about it. And these are the men who then are forced into marriages by their family members, thus making it extremely stressful for the man and for the wife. And they live a life long, sometimes they live their entire life being suppressed, being in denial, and this also builds up the stress in the relationship as well as for the husband and the wife. So these are some of the common problems that we have dealt with of the men who have come to us at our clinic. When men come to us for mental health issues, just like women, we at Wellness Space do a detailed assessment using self-assessment scales that are globally accepted. We also assess them for not just anxiety, depression, insomnia, and well-being, but we also do assessments for PTSD, CPTSD, and if they have a history of self-harm or suicide ideation and behavior, then we do also assess them for risk of suicide. And for such men who are highly volatile and who have a suicide risk, we also sometimes ask them to refer to a psychiatrist along with taking psychotherapy techniques from us. For the men who have come to us with these issues of, say, trauma or childhood abuse or volatile behavior, anger issues, addictions, etc., we usually use psychotherapy techniques like clinical hypnotherapy, inner child integration work. We use RTM, which is reconsolidation of trauma memory when they come to us with PTSD or CPTSD. We also use coaching, counseling, and in some cases, regression and past life regression as well. We also measure their progress after every 4, 8, 12, and 16 sessions to see if our modalities and techniques are really working for them or not. So if you are a man or if you are a boy or a young guy having these issues or having challenges with your mental health issues, and if you're looking for a safe space to talk about it and to work on it, then do reach out. Remember, therapy is not always the first option, but self-care definitely is. So if you as a man are struggling with any mental health issues, or if you know of your brother or a friend or a husband who has mental health issues, then please remember, the first step is to work on using self-care techniques. First step, of course, is awareness, and then using techniques for your own self to regulate your traumas, to regulate your nervous system, and then, of course, if needed, reach out for therapy or counseling. So I hope this video was useful, and if you like the video, please click on the like button, please subscribe, and please share with all the men you know around you, the men you love, and the men who you wish to help in your life.